Every woman, every child.
Every Woman, Every Child was designed to speed progress toward two of the United Nations' so-called Millennium Development Goals, improving maternal health and raising child survival rates. Reaching those goals could save as many as 16 million lives by 2015. And according to Susanna Edjiang, the project's general manager, that will require clearer policies and better health services. She says in just 1 year, she's already seen some of those positive changes.
We have seen how changes in policy have resulted in new cadres of health professionals being set up and deployed around countries like Bangladesh. The momentum is still going and we have more commitments on the table.
Commitments from more than 50 countries, says Yves Bergevin, senior maternal health advisor at the United Nations Population Fund.
Some governments have committed to change the age of marriage to, say, age 18. Others have said they would increase the coverage, the access to family planning services. Other commitments have to do with moving the share going to health to about 15% of government expenditures.
Despite these strides, there is much work left to do.
A woman still today in 2011 dies in childbirth every 2 minutes.
U.S. Secretary of State Hillary Clinton noted at a recent meeting of global health experts that between 1990 and 2008, there was a 34% drop in the maternal mortality rate worldwide. But she said even if the rate went down 40 to 50% in places like Bangladesh and Nepal, pregnant women in other places have not been so fortunate.
A woman in sub-Saharan Africa today remains 136 times more likely to die in childbirth than one in a developed country.
Owen Montgomery was in West Africa recently and saw the health challenges firsthand.
In parts of the world, such as Gambia, where I was just recently, it's more than a 2-hour ride by an ambulance, if you have an ambulance, to get to a hospital where they can do a delivery.
And that, says USAID Administrator Rajiv Shah, is why it is essential to find new ways to give pregnant women, especially those living in rural areas, quicker access to critical health services.
It's like low-cost resuscitation devices, improved jaundice treatment systems, electronic and cell phone-based blood monitoring so we can monitor blood loss, and new drugs and diagnostics.
The UN Population Fund's Yves Bergevin says he has seen progress in Ethiopia, Rwanda and Burkina Faso.
Trying to go from a business as usual to a global movement for women and children with real measurable commitments will keep partners accountable.
Something, Bergevin says, that will be very different from the past. Mariama Diallo, VOA News.